Let's take you live there now.
Report, and then we will brief Masses in the audience so that we allow my journalists to go back and report. Over to MEC.
No, thank you very much. I think we are skipping a briefing here too because you have been waiting for long. Not ladies in Umapisa show. Are you correct? I wish to acknowledge and appreciate the presence of the head of department, Mrs. Mrs. Penny Msimang, management of eThekwini. As indicated, there's two acting directors, Ms. Tusile Mbambo, no Mr. Nati Shabane, the management of Mahatma Gandhi Memorial Hospital, the people that are watching us at home, members of the media, ladies and gentlemen, good morning. I'd like to start these proceedings by wishing all of you a happy new year, including those that are watching us at home and on our social platforms. Indeed, 2025 might not have been the best year for all of us, and you know, the first of the year gives all of us an opportunity to start afresh. It's always a new day. So we hope that all of us will be able to start whatever we felt was not done properly in the previous year and be able to do it better in this coming year. We are gathered here today at Mahatma Gandhi Memorial Hospital, which is in Durban, to welcome a special group of bundles of joy, KwaZulu-Natal's first babies for the year. These babies are the future of our province. Their arrival reminds us of our shared responsibility to nurture, protect, and guide children from the very first day when they arrive. Indeed, how we care for these children today will shape the future, will shape our future and the future of the society at large. At this point, I wish to once again extend our heartfelt gratitude to all healthcare professionals, from nurses, midwives, doctors, cleaners, porters, administrators, and to security staff. Because as we always explain, everyone who works in the health center and in a hospital or clinic in particular becomes a health worker when we categorize them. The arrival of a new year also provides an opportunity for reflection on our own health and the steps we can take to stay healthy. In this regard, we encourage everyone to embrace a healthier lifestyle by following a healthy and balanced diet and also getting into the habit of regular physical exercise. This is one of the areas that as a province we have decided to focus on in this coming year, the issue of a healthier lifestyle. We are going to have a number of different activities, different programs that will target our health workers, that will target our senior citizens, that will target young people, but will target the middle-aged as well and those that are working adults. We have noted that if we don't focus on healthy lifestyle, the non-communicable diseases increase, and as the non-communicable diseases increase in the province, it means we have to pour a lot of budget towards that, and these are lifestyle diseases that can easily be dealt with. That is why we have decided that this coming year, the theme for the province of KwaZulu-Natal is Asibe Healthy KZN. So you will be hearing a lot of Asibe Healthy KZN and the Asibe Healthy KZN programs. It will not be just one program, it will be a number of programs, but the intention would be the same towards ensuring that we reduce those that are affected by non-communicable diseases. We found that a disease like sugar diabetes, for instance, is also beginning to increase very much amongst our young children, and you know, if we don't do something about it, it means as a province we will continue to have more challenges. We also encourage women to look out for signs of breast cancer, such as foreign lump, sore, mass, or unusual development on their breast. Of course, this is not just for women. Men as well are expected to do the same, because sometimes men are also affected by breast cancer. We also encourage them to get screened for cervical cancer, this is women, and to speak to their healthcare providers about getting a pap smear so that any cancerous cells can be detected early. And as a Department of Health, we provide this service for free in our hospitals and in our clinics, and we encourage women to go and make an appointment so that they get their pap smear test done. Men are also encouraged to undergo screening and testing for prostate cancer from the age of 50 years old, for those who don't have a family history of prostate cancer. But for those that have a family history of prostate cancer, the age is reduced to 45 years. We expect and request men to get tested annually so that we are able to detect this cancerous cells within the system as quickly as possible, and we are able to give the men treatment. We also urge everyone to monitor their blood pressure, diabetes, and cholesterol levels, and to adhere to their treatment schedules for those who have been diagnosed. Let us all remember that the early detection and prevention of diseases is crucial, as it saves lives and can prevent serious illnesses from progressing. We have found that over the festive season, those that are on chronic medication sometimes want to go on what we term a holiday. A treatment holiday, that's the word I was looking for. They go on what is called treatment holiday. They say because it's a holiday, it's holidays, we have Christmas, we have New Year, therefore they are putting their tablets aside for that for a short while. And we want to call and want to make a call to all community members to say, let's not do that. And those that are looking after our elderly who are on chronic medication, please let's ensure that they take their treatment and adhere to the treatment as has been indicated. Those that are on treatment themselves, chronic treatment themselves, we are talking about your ARVs, sugar, diabetes, BP, and the list is quite long. Please make sure that you adhere to the instructions that have been given to yourself by health workers, because medication holiday causes a problem later on. You know, from the 2nd of January, these hospital in particular and other hospitals will have a lot of people flocking in purely because they have defaulted from their treatment. And defaulting is not just about ARVs, it's about any other treatment that you are given and you don't adhere to it the way it should be adhered to. So we are making that call that please let's ensure that we take our treatment as it has been given to us. On the issue of maternal and newborn health, we want to call upon all mothers and their families to acknowledge that regular antenatal care is critical to the identification and management of any pregnancy-related risk. Furthermore, delivering your baby at a health facility remains essential for reducing maternal and neonatal mortality. We understand that there are those that are at home, and some consider themselves to be traditional midwives, but we encourage very much that delivering your baby at a health facility remains essential and crucial so that we are able to observe your child as and when they come into the world. Postnatal care is equally vital, as it ensures that both mother and baby are always healthy and thriving. As a department, we remain committed to improving maternal and newborn health outcomes across the province. By the same token, we urge parents to be alert to any warning signs that may require urgent medication attention and to seek help urgently. We also wish to take this opportunity to warn our communities about the dangers of alcohol consumption, especially for pregnant women. Asked on some occasions that why do I continue to talk about alcohol and particularly alcohol amongst women, and people believe that it has nothing to do with the Department of Health. We beg to differ. It has a lot to do with the Department of Health, especially amongst pregnant women. Sometimes it looks as if I am picking on women only when I talk about alcohol consumption. But yes, we want to talk about alcohol abuse. We speak about alcohol abuse, or we speak against alcohol abuse generally. But we specifically want to say to women, when we are pregnant, if you are pregnant, please stay away from alcohol. There are those that might not be aware that they are pregnant but are of childbearing age. It also is very important that you stay away from alcohol, because you might actually be pregnant and not be aware of it. Like I said, as a Department of Health, we have a vested interest in the intake of alcohol, as it does affect us. Because when a woman drinks while she's pregnant, she jeopardizes the health, development, and well-being of her unborn child. Even if we may seem like we are targeting women, and we are not, but we speak out against this practice because it is important for us to do so. We are just doing our job, because alcohol is also a serious societal problem. Of course, that is together with drugs. Therefore, we want to emphasize that there is no safe amount of alcohol during pregnancy. No safe amount. You know, sometimes we get young women or those that are partying to say, if I just take a glass of champagne, because sometimes people think that champagne is less of alcohol than the other kind. But a sip of alcohol to a pregnant woman is just as dangerous as a full glass. So no amount of alcohol is safe at any given time when we are pregnant. Not even one sip. Because alcohol can cause lifelong brain damage and physical disabilities in an unborn child. We also call upon all our communities to ensure that children are never given alcohol or encouraged to consume alcohol. A few days ago, we were shocked and disappointed by the emergence of a video on social media where adults are seen encouraging children as young as 5 years old to consume alcohol. Of course, none of us know at this point where the video comes from, but the fact that it is doing the rounds on social media is of serious concern to us as the Department of Health. Such conduct by grown-up people is extremely harmful to children's development and safety and must never be allowed. It is a sad day when children's health and well-being are sacrificed at the altar of content creation for social media, because it does look like those that were taking that particular video were doing so that they are able to post content. And this affects children adversely. We must never ever chase after social media fame at the expense of our children. Allowing children to consume alcohol at an early age is dangerous, as it damages brain development and increases the risk of injury, abuse, and addiction. It also increases the likelihood of risky behavior, including alcohol addiction later in life. Therefore, adults must create safe, healthy, and nurturing environments for children. We also call upon families and communities to intervene when children are at risk and report these harmful practices. We are hoping that government is following up, or the relevant departments are following up on that video in particular, because when you look at the video, you can see that there's close to 10 children that are there and are given alcohol, and we don't believe that actually should continue and should not be punished. At this point, I would like to share an update on the New Year's Day babies who have been born across our province. Although the details are still being consolidated, but I can tell you that as of 7 a.m., KwaZulu-Natal had registered a total of 63 New Year babies made up of 31 girls and 32 boys. By 10 a.m. today, the number had grown to 90. This is due to the arrival of 13 more babies and 14 more girls, which gives us a tie of 45 apiece on either side. Okushukuthi-ke kuyi-draw, 45 girls and 45 boys okwamanje. And the first baby of the year, a baby boy, arrived at 12:20 at Queen Nandi Regional Hospital. He was born to a 31-year-old mother with a birth weight of 1.82 kg. You'll remember I explained on Christmas Day on what is our obsession with indicating the age of the mothers. He was followed by another baby boy 2 minutes later at RK Khan Hospital, who was born to a 33-year-old mother. Our third New Year baby was born to a 26-year-old mother at 26 minutes past 12 at Maternal Hospital, which is in KwaZulu-Natal district. The fourth New Year's Day baby was born here at Mahatma Gandhi Hospital at 17 minutes to 1 to a 30-year-old mother. The baby is amongst our 4 New Year's babies in this hospital, Mahatma Gandhi. Of course, we still have mothers that are in labor, and we are expecting more children to come into the world. As more information becomes available, we will continue to share updates on other babies who have started the year with us. While we welcome these New Year babies, we must also register our concern again, particularly over our very young mothers. On Christmas Day last week, KwaZulu-Natal recorded a total of 302 births, which was made up of 166 girls and 136 boys. Alarmingly, 70 mothers within these 302 were teenagers, with the youngest being the 3 15-year-old girls that we spoke about. Among these young mothers was a 16-year-old girl who was impregnated by a 32-year-old man. So far, the youngest mother of our New Year babies are 2 16-year-olds who gave birth at Benedictine Hospital under Zululand District and at Queen Nandi Regional Hospital under KwaZulu-Natal District, respectively. This 16-year-old doesn't make it any less problematic, because when she gives birth, or when they give birth at 16 years old, it means they fell pregnant when they were 15. And that is a serious problem, a serious societal problem that we are faced with. In both instances, the fathers are 21-year-olds. What is also concerning is the fact that these girls were 15, just like I said, when they fell pregnant. We have had a total of 13 teenage mothers, including one 17-year-old in Newcastle, 4 18-year-olds, one Prince Msheni, 2 Mseleni, and 1 at Queen Nandi, and 2 19-year-old mothers at one Mahatma Gandhi and the other one at Eshowe Hospital. These statistics are cause for deep concern and highlight the ongoing need for education, guidance, and access to reproductive health for teenagers. As government, we provide this information. As government, we provide this education, but we can only win this battle if we are able to work together with society. We can only win this battle if we are able to work together with parents, because they are the ones who are providing guidance to children and teenagers at home. So please, we are really making a serious plea that we take the matter of educating our young ones very seriously as parents. Let's not give away our responsibility, or let's not abdicate our responsibility as parents to government. Government has a role to play, and yes, we expect government to play that role, but as parents, we also have a role to play together as society. So we are making that serious call again to our society and to our parents. While it is critical that we work together to prevent teenage pregnancies and support young mothers, in order to make our provincial teenage pregnancy strategy work, we must also ensure that every child born is given the best possible start in life. So as the Department of Health, once a child is born, regardless of the age of the mother, we have a responsibility of ensuring that that child gets the best possible start in life. This begins with proper care, nutrition, and protection from diseases, which are essential for healthy growth and development. Let us now turn to the key steps parents and caregivers can take to safeguard the well-being of their newborns through breastfeeding, proper nutrition, and timely immunization. Exclusive breastfeeding for the first 6 months strengthens immunity, supports brain development, and protects against infection. It is important. We need to make breastfeeding fashionable. We are aware that some young mothers don't see this as a good fashion statement to breastfeed, but we want to say breastfeeding is important, therefore breastfeeding must be fashionable. Proper nutrition during the first 1,000 days lays the foundation for physical, cognitive, and emotional growth. We call upon parents to monitor growth charts and attend regular weigh-ins at clinics to ensure their babies' healthy development. Vaccinations protect children from preventable diseases such as measles, polio, and tuberculosis. Therefore, mothers must ensure that the Road to Health booklet is updated and that no vaccination appointments are missed. Let us forget what has been said or the misinformation that has been provided and put out there, particularly on social media, about vaccinations. Vaccinations are important. Vaccinations are the reason that most of us were able to fight measles. Vaccinations are the reasons why we have eradicated polio in South Africa and we are able to address and deal with tuberculosis. Ensuring that children grow healthy and protected is only one part of safeguarding our communities. Equally important is protecting adolescents and adults from HIV, which continues to affect many families in our province. In this regard, we are excited about the introduction of lenacapavir, a long-acting injectable PrEP that will soon be available to strengthen HIV prevention efforts. This, we are informed by our National Department of Health that it will start being available to us in February. And we are calling on community members who feel that they are at risk, who feel that they might need this injection, to come forward and start register so that when the injection becomes available in February, then they are able to get the injection. As provinces, we are all expected to launch this lenacapavir injection. We have started as the province of KwaZulu-Natal with our own launch. We were in Newcastle 2 days ago. Was it 2 days ago? 2 days ago to have this launch. We are going to continue with our road shows in the rest of the province so that people are aware of this injection and people know that it is available and when they are going to be able to get it. This injection is a game changer in our fight to curb the spread of HIV. But because this word is long and may be difficult for some to pronounce, we've just decided to simply call it Ulena. So they must just come and request Ulena, and then all of us, we will know what are they talking about. Administered just twice a year, Ulena simplifies adherence while offering strong protection for HIV-negative individuals. It is important to point out, though, that this injection does not protect against other STIs, nor does it prevent pregnancy. So condoms and family planning remains essential. We will continue to conduct awareness campaigns throughout the province, like I said, ukuze abantu bamazi Ulena, so that they get our communities get educated on its safe and effective use. As I conclude, I wish to say, let 2026 be a year of prevention, protection, and nurturing for every child. We continue to call on families to make healthy choices, attend clinic visits, and create safe environments. We call upon communities and leaders to support parents and safeguard children from harm. And please remember that prioritizing our own health ensures that you can effectively you can care effectively for your child and loved ones. Finally, we want to say, as of the first today, we are also very excited to announce that we will be receiving 1,200 community service personnel, which is made up of nurses, doctors, and allied health professionals. That is for the whole province, 1,200. I thought we were going to get clear. We are also receiving medical interns in various hospitals across the province. They will also be starting work tomorrow on the 2nd of January. We thought it's necessary for us to indicate this in particular because in the last weeks of the year, November and December, there has been some confusion on whether the province of KwaZulu-Natal will be getting any ComServes or will be receiving any medical interns. In fact, there was a voice note or a message on social media that was saying as the year is starting, there's not going to be any medical interns in this province and there's not going to be any doctors that are going to be accepted for ComServe. So we want to say with a very serious excitement that that is not true, and indeed they are going to be starting tomorrow, and we hope that the 1,200 that we are receiving will be able to assist us towards the service delivery that we have a responsibility of providing. Thank you very much, ladies and gentlemen.
And that was the MEC of Health in KwaZulu-Natal, Nomagugu Simelane, addressing the media there and, of course, speaking on a wide array of issues, calling on those in KZN to adopt a healthy and active lifestyle, launching what she calls the year of Asibe Healthy KZN. And, of course, encouraging positive health-seeking behavior, asking men above the age of 45 and 50 to seek prostate cancer exams, as well as for women to undergo pap smears and seek cancer screening for early detection purposes, and encouraging those in KZN to take on lenacapavir, which is a 2-time annual injection for the prevention of HIV, the spread and contamination thereof.